having me. It's always good to spend time with you, David.
Thanks, Ben. So I was thinking that we could maybe talk a little bit about COVID. So, you know, my mind goes, I don't even know what the right question is. My first question was, what do you see, you know, and I think it's actually a cool thing that you're in kind of this, I would say, semi-retired kind of spot, because you have a cool vision, a cool view of what it is. What do you see the role of integrated behavioral health as far as helping deal with COVID?
Well, I think that we've already learned one important thing, and that is it's extremely likely that our frontline medical and nursing staff are going to be overwhelmed. And I think it's probably very important for our behavioral health providers to stand back and think about, what does this system need that I'm working in now? Because there's only so much skill-wise that we're trained to do in actually dealing with people who have respiratory distress and fever, et cetera. And so I think providing support is obvious, and it's very important. I think a second thing that we can do is buddy up with the people who have the responsibility to monitor how the systems are functioning and design them in a way that best meets the needs of the population and keeps the clinicians safe. And so our capacity as integrated behavioral health providers to think about systems is critical. It's absolutely critical. What do we do to make sure that, you know, we have a balance of providers? What do we do to compensate for a lack of expertise? How do we train? How do we think ahead of time about training others, cross-training others to step in when our core frontline staff is either homesick themselves or exhausted? And then third, I think there is going to be a significant component of the population who are suffering from panic and fear for good reason. Yeah. And there's a lot to be afraid about. And so to develop strategies for helping them. I'm reading a fair bit about this on the Collaborative Family Healthcare listserv. And again, people tend to jump too quickly to a model and forget that it's very, very important to be curious about each individual's risks and life issues. I mean, some people have a wide range of issues going on in their lives that contribute to their anxiety, and it's important to be able to identify those things as opposed to just apply, you know, sort of a blanket cognitive behavioral strategy, manage your thoughts. You know, we need to figure out what those individual things are. So, you know, I think curiosity about each individual's needs is also important. So there's a lot I think that we can do.
You know, Larry, and that last point, I was just having a conversation with someone else about this yesterday through email, and I think that last point is so telling. Like, talk about a context, or talk about a system right now where anxiety is rampant in, right? Like, I think we're all feeling that in so many different ways. And as you said, though, it's not like one blanket intervention is going to be useful for every single person. And I love the thing about that curiosity. And again, I think that's you're talking about this throughout, this humility that for us to have, which I think turns us to be curious about what is going on with people and our patients and even our providers. I know for me, absolutely. You know, there's been, you know, conversations with different things over this past week with my teammates, and I'm sitting here scratching my head. It's like, well, why are you doing that? And then my mind immediately goes like, if you're asking yourself that, you need to be curious, because there's probably a damn good reason why that is. I think that's huge.
Yeah, there's a lot of misinformation. People that is out there. People also aren't, you know, stopping to think about, you know, what they can do. And, you know, I mean, there's also there's also really, you know, the question, what's the worst possible thing that could happen? well, we're hearing stories about that.
Yeah.
You know, it's quite a challenge, and we also have to, you know, recognize the limits of our power, you know, of what we can do. But being present, I think being members of the team and supporting the team effort really makes a big difference. And you know, integrated behavioral health providers have the capacity to do that. We need to think certainly well beyond just the needs of individual patients now.
And I love it. I'm going to end with that because that's what I've been telling people: be present. In any way, you know, it's not to say again if things, you know, if people are moving to tele and stuff. There's still ways of being present even through tele medicine. But I think that's the key thing is like be there. Be there.
Yeah. Well, you know, the good news about technology today is that it provides a virus-free way of providing care. Telehealth is a huge opportunity to make a difference that didn't exist in 1918.
Absolutely.
Yeah.
Well, again, Larry, I appreciate the conversation, man. Enjoy the day. Hopefully you're in Seattle right now, right?
We're in Seattle, but we're moving back to our cabin in the woods in north central Washington, where we're a little bit more separated from, at least physically, more connected with woodpeckers and trees than with people.
And I like that word, connected. So it was, again, so good to